What happens to your corneal flap during LASIK recovery? Imagine your eye as a tiny, complex universe. During LASIK surgery, a thin flap is carefully created in the cornea, usually about 1 to 200 microns thick. This flap is gently lifted to give the laser access to reshape the underlying tissue and correct vision issues like nearsightedness, farsightedness, or astigmatism. After the laser does its job, the flap is gently laid back into place without stitches. Right after surgery, the corneal flap begins to adhere naturally to the eye's surface. This happens because the eye's internal mechanisms help maintain hydration and pressure, acting like a gentle suction to keep the flap in position. The outermost layer of the cornea, called the epithelium, starts healing quickly. Within hours, the edges of the flap begin to seal, creating a barrier that makes the boundary almost invisible to the patient. Usually, this initial epithelial healing is complete within 1 to 2 days, providing a secure seal around the flap. Beneath this outer layer, the middle part of the cornea, called the stroma, starts a slower healing process. The stromal tissue around the edges of the flap begins to stabilize over time. It's important to note that the bottom of the flap does not fuse or grow into the underlying tissue. This non-fusion is actually beneficial because it keeps the cornea transparent and preserves the visual benefits of LASIK. Instead, the flap remains held in place, mainly through mechanical stability and natural adhesion processes. Over the next several weeks to months, the stromal tissue continues to heal and strengthen the attachment of the flap. Most patients find that their flap becomes quite stable within the first week, allowing them to resume normal activities. However, full healing and stabilization can take up to 3 months or longer. During this period, it's vital to avoid rubbing the eyes or exposing them to trauma, as these actions could dislodge or damage the flap. In essence, the corneal flap is initially held in place by natural adhesion and epithelial healing that begins immediately after surgery. Over time, stromal healing reinforces this attachment, ensuring the flap remains stable and the cornea stays clear. This process supports quick visual recovery while maintaining the eye's structural integrity. For those with eye conditions like glaucoma or macular degeneration, proper flap healing is especially important to prevent complications that could affect overall eye health. Regular follow-up visits with an eye care professional help monitor healing and ensure everything is progressing smoothly. Remember, every eye heals a little differently, so personalized care and patience are key to a successful LASIK recovery.